Right, good afternoon, and thank you so much for the invitation to present today. As Heather said, I'll be talking mostly today about psychosocial support needs and resilience building strategies for families navigating CDG. Just give me a sec here. Hopefully I'll be able to advance the slides. So just as a brief overview, today I will describe the psychosocial impact and some of the stressors that families face. I'll also talk about the limited research that's known about behavioral health risks for individuals with CDG. And then I'll end by reviewing psychosocial resources and strategies to support resilience. So, as we're all well aware, CDG is characterized by marked variability in both the type and severity of its physical and behavioral manifestations across subtypes, as well as both within and across individuals. So even if a child, adolescent, or adult has only mild symptoms across body symptoms, the cumulative effect of the condition can still be substantial and significant in terms of both the physical and mental health, as well as the impact on the family. It's important to understand the psychosocial impacts associated with CDG in order to maximize the likelihood of achieving healthy psychosocial outcomes and good quality of life for affected individuals and their families, and importantly, to provide anticipatory guidance and referrals to behavioral health treatment if indicated. So I'm going to start today by talking about the psychosocial impact on the family. And my hope today is really just to validate some of the challenges that parents face when they're raising a child who has CDG. It's an exceedingly stressful experience to have your child diagnosed with a rare and potentially life-threatening condition. Feelings of grief and loss are really common, along with feelings of confusion, anger, guilt, anxiety, and sadness. And it's important to remember that these are normal reactions to unusual life events. Each parent and family member may experience these families at different times, but they're quite common around the time of diagnosis. Most families are able to regroup and adjust over time to their child's condition, but it's important that this takes time, and it can be an unpredictable process. There may be periods of stability as well as periods of medical crisis. There will likely be times when families feel like they can handle everything, and other times when they feel like they may be very overwhelmed. Additionally, families have to learn to navigate the healthcare system, and is what is often a very stressful time, particularly at that time of diagnosis or if a critical event brought you or child into the hospital. And as you're all well aware, navigating the hospital and the medical system is quite a challenge. It's a very different culture to navigate, especially when we're thinking about fragmented care and some of the other issues that go along with that, including dealing with insurance coverage. So when thinking about psychosocial impacts on the family, it's important to keep in mind that CDG-related challenges will vary depending on the developmental stage of the child. As we just heard Mel talk about transition, so when young people approach adulthood. We also know that the type and severity of the condition and related interventions can impact levels of stress, and family resources and stressors. So for example, families may experience more stress and burden of care depending on their child's healthcare needs, number of interventions. We also know that pre-existing stressors like unemployment, family problems like divorce, can also contribute to how well a family adapts to their child's diagnosis. While recent advances in genetic testing and growing awareness of CDG are enabling more families to find out about their child's diagnosis sooner, many still face what we call that diagnostic odyssey, where they face a myriad of tests and evaluations and visits with countless specialists before they get an answer. And because CDG is rare, it can be hard for parents to find accurate information about their child's disorder and its management. It's also hard to find appropriate care. Parents often have to travel a distance to find a specialist, and they might find themselves in the uncomfortable situation of sometimes being the expert in the room about their child and about CDG. We also know that parents face a number of different points of uncertainty. First of all, oftentimes their diagnostic experience begins with not knowing what is wrong with their child. And even once they get an answer and know what is wrong, they have to navigate the fact that there may be no treatment or cure and no clear way to predict the child's prognosis or outcome. And that can become a really great source of stress and overwhelm and worry for parents. So I think one of the greatest challenges that families affected by rare conditions face is isolation. Knowing that your child is one on the planet who has a particular condition can make you feel pretty alone. Unlike common pediatric conditions, it can be hard to find other families who know what you're going through or who have walked this path ahead of you who can offer practical tips and advice. And family and friends, while they can be a great source of support, they may still not be able to relate and understand what you're going through. We also know that financial strain is a significant source of stress and can have psychosocial downstream effects for families. For example, traveling for medical care, repeated hospitalizations, prescriptions, navigating home health care services, developmental therapies, assisted devices. They can all be incredibly expensive, even if you have insurance. We note, too, that having a child with special health care needs can affect employment, child care barriers. There can be challenges with making your home or vehicle accessible. And then, as I mentioned, even navigating insurance can be particularly stressful when you have a rare disease because insurance companies, Medicaid, SSI disability may not appreciate or recognize the condition that your child has. And that just puts you down another rabbit hole of trying to navigate those particular systems. So not surprisingly, the cumulative effects of CDG-related stress can lead to psychosocial difficulties. Caregiving for a child with significant medical problems can put strain on relationships, both within the context of a marriage or a partnership. We also know that siblings can sometimes feel like they're lost in the shuffle or have to take on more responsibility, so it can affect how you parent siblings. And relationships with other family and friends can also be a significant challenge just because lack of time, or maybe they just don't understand how to help. When we're thinking about these types of stressors, isolation, uncertainty, financial strain, and the chronic worry about a child's health condition, that can lead to problems in caregiver burnout, anxiety, and depression. The stress is real. Finally, there's evidence that chronic stress, including caregiving for a child with special health care needs, can lead to physical health care problems for parents, and stress is known to reduce immune system functioning. So I'm going to switch gears a moment now and talk a bit more about what we know about behavioral risks for individuals with CDG. If we take a step back and look at what we know about children who are diagnosed with other chronic health conditions, we know as a group they are at greater risk for psychological problems relative to physically healthy children. Similarly, we know that children who have developmental or intellectual disabilities are also at higher risk for psychiatric disorders. And by psychiatric disorders, I mean things like anxiety, depression, et cetera. In fact, in the general population of individuals with intellectual disability, approximately a third may have a co-occurring mood or anxiety disorder. If we look at what we know about children with CDG, we know that they are at risk for global developmental delays, intellectual disability, and that those that have more neurological impairments, so for example, having seizures or epilepsy, that can contribute to the risks for both developmental and intellectual disability. There have been a handful of studies looking at behavioral health risks, so looking at things like social and emotional problems in children with CDG. There was a study done back in 2013, a small sample of 18 children, 50% of those who had PMM2 CDG, that found increased risks for social and emotional problems, including withdrawal or depressive symptoms, as well as somatic complaints, so more like complaints about body aches and pains. Similarly, there was a study of 41 patients with ALG6 CDG that found approximately a third had behavioral problems, including autism spectrum disorder, mood changes, aggressive behaviors around puberty, sleep disturbances, and repetitive behaviors. Interestingly, there was a recent study that came out just last year that showed that depression in of itself, while sometimes can still occur in children with CDG, appears to occur at a lower rate than even in the general population. Anxiety and fear, though, anecdotally have been reported by many caregivers of children with CDG. So this means children may experience worries or fears, which may lead to avoidance of certain activities. Agitation and aggression have also been anecdotally reported by caregivers. And whenever we're talking about agitation and aggression, I think it's also important to keep in mind that particularly when children are nonverbal, we want to take a look at their physical status and make sure that they're not responding in an agitated or aggressive way because of pain, or that there isn't something going on like an infection, a UTI, that may be causing some of those behaviors. I wanted to take a moment today, too, to talk a bit about the strain and stress of undergoing multiple medical care experiences in the context of their childhood, adolescence, and adulthood. And I think it's something that we don't always stop to think about. It's the burden and the stress that goes along for the child in terms of enduring medical examinations, blood draws, IV placements, EEGs, having to undergo MRIs or other types of imaging and surgery. And we know that for some children, these procedures can be endured with significant amounts of discomfort, fear, and pain, as well as anticipatory anxiety about those procedures. In the pediatric medical literature, there's a construct that we're giving more attention to lately called pediatric medical traumatic stress. And the easiest way to describe this is that we're recognizing now that medical care experiences, particularly those that are frightening, that are focused on a lot of pain, can result in what we call almost PTSD-like symptoms. We call this pediatric medical stress, medical traumatic stress. So the definition is that it's a set of psychological and physiological responses to pain, injury, serious illness, or medical procedures, or invasive or frightening treatment experiences that can occur in children. It's important that this can show up in caregivers as well. While many of these symptoms are not uncommon, it's not uncommon for children to be fearful of a needle stick or a particular procedure like an MRI, oftentimes these symptoms can persist. And when they persist, we begin to think more about medical traumatic stress, or if they're causing significant challenges or distress in everyday life. Another important issue that I just want to mention too is that sometimes the behavioral health aspects of or co-occurring conditions can be overlooked because of a tendency to attribute any behavioral problems to an individual's developmental disability or their underlying medical condition, which means that symptoms of behavioral health problems may go unrecognized and untreated. So evaluations or treatment for behavioral or psychiatric concerns are indicated if a behavior or challenges are really causing significant stress or distress at home, both for the child or for the caregiver, or if you're seeing a negative impact on their daily functioning, if they're really affecting a child's ability to go to school or to engage with their family. I did want to highlight that the international clinical guidelines that have been developed for PMM2 CDG do acknowledge that it is important for cognitive and development assessments to occur, both at diagnosis and then every 1 to 2 years as needed. Oftentimes, these evaluations will include some assessment of behavioral and/or social functioning. So it's important to have an assessment to understand what your child's strengths are and what areas in which they may require additional support. You will also see that psychiatric evaluations are listed there on an as-needed basis. And it may be beneficial as we learn more about the behavioral health risks that go along with CDG. It's possible that the frequency at which these evaluations are recommended may change. So in terms of assessment and treatment, it's important to take an interdisciplinary approach whenever possible, meaning that there should be collaboration between the behavioral health providers like psychiatrists and psychologists and the individual's medical specialists. And it's critical as a first step to rule out any physical problems that could be responsible for symptoms and then to proceed with a psychological and/or psychiatric evaluation. Oftentimes, behavioral therapy is a first-line approach to addressing a problem, although anxiety, mood, and some other behavioral disorders, a combination of medication and therapy may be most effective. And in some instances, a trial with medication may be appropriate as a first-line approach, particularly if there are concerns about a young person's ability to participate in therapy. I did just want to spend a moment to clarify the difference between psychiatrists and psychologists. We're often confused in terms of what we do. It doesn't help that both professions start with PSY. So effectively, psychiatrists are physicians, so they're MDs who can prescribe medications. A small number also do therapy, but in our country at least, that's a rarity these days. Another specialist that you may want to consider engaging with would be a developmental pediatrician. These are pediatricians who specialize in working with children who have developmental disabilities or syndromes, genetic conditions that may have behavioral health risks associated with them. They can be wonderful assets in terms of being able to help prescribe medication. We also know that psychologists like myself can offer support, education, skills, and interventions to address behavioral health concerns. So we do more of the therapeutic approach, more of the education and the skill building. And even if a child is unable to participate in therapy, oftentimes we work with parents about coming up with home programs, strategies to navigate behavior across settings. For the final part of my talk today, I wanted to touch on resilience. In addition to the stress and struggle that many families encounter associated with CDG, we know that we are a remarkably resilient group of people. And oftentimes, growth and positive change can occur despite the stress and struggles that we experience. Many people report positive changes in their relationships, a greater strength of sense and self-worth, increased or appreciation or engagement with spirituality, a heightened appreciation for life and what is important, and a desire to give back and to help others. And I think we have many, many examples of resiliency in this room as we've witnessed over the past couple of days. So I'll touch on a few strategies that we can cultivate to support resilience today. And I'm going to start by talking about information and support. So we know that information about CDG is key, particularly in this era when research is expanding and new developments are rapidly occurring. Because of dedicated families like yourselves and researchers, clinicians, and advocates, there's growing awareness of and access to both information and support for individuals affected by CDG across the globe. And thanks to social media and the internet, these resources are more easily accessed and can be a tremendous source of not only disease-related information, but it's an opportunity for families to connect and to share their stories. There really is power in sharing your story with other people, and it can really help to decrease your own sense of isolation, but it's important because the impact may actually be life-changing for another family. We also know that family and friends and community supports, both online and in real life, can be important. And then talking with a psychologist or a counselor. My hope here today is that you'll give that some consideration. I know sometimes there's some stigma around seeking out mental health support, but I think we really can be helpful to families in terms of navigating decision-making, skills, challenging periods of time, medical crises, et cetera, and really help families come up with strategies to cope. Interestingly, there was a recent study that looked at resilience in both patients and family caregivers of individuals with CDG that found an association between professional and peer support and resilience, meaning that those individuals who had professional and peer support appeared to be coping better and were more resilient. I wouldn't be a good psychologist if I didn't talk with you a bit about self-care. As parents, it's particularly easy to put your own needs on the back burner, and this is even more true when you have a child with a chronic medical condition. But sleep, nutrition, exercise, finding time to engage in hobbies and interests, relaxation strategies, these are really critical to giving back to yourself. We know that parents often find that they are better equipped to handle stress when they are taking better care of themselves. I'd also like to mention that family functioning is another important component of resilience. It's important to communicate with each other, and if you're finding that communication is breaking down, that can be another reason to seek out some professional help. It's important to talk about feelings, both positive and negative, and to think about not letting CDG take over the family, looking for opportunities for fun and for normalcy. And then I know our next speaker will be talking a bit more about siblings, but it goes without saying that we want to be conscientious about the roles that siblings are taking in families. Sometimes they tend to grow up a bit faster, assume more responsibility. It's important to remember that they are children too. They have needs, although they are different ones, and we want to make sure that we're giving them time and attention as well. Another strategy for cultivating resilience has to do with maintaining a healthy perspective, really tuning into your own self-talk about various situations. So thinking about your thinking. Can you make positive or neutral appraisals as opposed to negative thoughts about a stressor or a situation? If you tend to look at more the negative side of a situation, can you play devil's advocate and look for potential benefits? Reminding yourself about how you've overcome challenges before. How did you feel then versus how you feel now? And then also, again, thinking about how your experience or story may potentially be of service or benefit to other people. I also just wanted to touch on how we can leverage resilience and engage in strategies to help both children and families cope with medical care, given that we know that that can be stressful and potentially lead to what we call pediatric medical traumatic stress. So one of the things I recommend to parents and to individuals and healthcare teams as well is to offer choice and control whenever possible. It can be as simple as giving a patient the option of whether they want to have a blood draw from their right or their left hand. It can also mean thinking about what kinds of comforts can they bring to that situation. How can you advocate for appropriate pain and anxiety management, even for procedures like blood draws? There's EMLA cream for needle sticks, for example. Thinking about, in some instances, some procedures may need to be done under sedation, and that's okay if that's going to be less stressful and traumatic for a child. Maintaining routines as much as possible, thinking about distraction. You know your child best, and thinking about how conveying that information to the medical team. For children who are nonverbal or who are on the autism spectrum, sometimes social stories can be a good way of helping to prepare them for procedures. And another kind of group of specialists I'd like to put on your radar are child life specialists. These folks are often present in hospitals and can help facilitate coping for children, especially if they have a lot of fear or anxiety around procedures. So I'll end just with some resources here. If you're interested in learning more about pediatric medical traumatic stress or how to find referrals in your area for either psychologists or psychiatrists, you're also always welcome to reach out to me if you have further questions about that. So I'd just like to thank you for your time today, and I'm happy to answer any questions.